Hi, I'm Dr. Mickey Barber with Better Life Carolinas, and I just want to give you some new thoughts about COVID and also talk to you a little bit about healthy aging. If you've been following us at all, you know that September is Healthy Aging Month, which is really what Better Life Carolinas is all about. And really, I don't think there's a topic that's more important during this COVID crisis than a healthy aging plan. So we really encourage all of you, if you're not already working with a physician and a well-qualified medical team that is up on the latest in healthy aging, now is exactly the time you need to do this. So we know that we are more at risk for COVID once we're over the age of 50. And so that's why it's so important, no matter how old you are, to really start looking at this from a holistic perspective. So part of the reason that we're more vulnerable after 50 really has to do with our biological age. And that is about several factors. One of those is our gender. So unfortunately, men age faster than women. There's some things we can do to help that, but that is a scientific fact. Secondly, our chronologic age, so how old we are. And the third most important factor, and really the only one we can control, are age-related diseases. So those diseases are things like hypertension, obesity, diabetes, dementia, Alzheimer's, sleep apnea, lots of things that are associated with the aging process. Those are things that we focus on at Better Life Carolinas. So just digging in really at a cellular level to help to prevent or turn those diseases around will lower your risk of getting ill or even dying from COVID. So again, please check with us because I know we can help you. Some other things I wanted to point out that I think are kind of interesting. Some of the things that we've been using in our age management program at Better Life Carolinas, like, for example, estrogen. There are a couple articles out there showing that women that have high estrogen and progesterone levels actually seem to be protected against the coronavirus and COVID-19. So achieving optimal hormonal balance we think is very important, obviously, to have a healthy aging program, but probably will help to protect you against the coronavirus. I think the data is a little confusing when it comes to testosterone in men, and we can go into that if we have a one-on-one conversation. But what we do know is that men that have low testosterone are at greater risk for diabetes, obesity, increased visceral and abdominal fat, sleep apnea. So just getting your hormone level and your testosterone level optimized will lower your risk of those diseases, which in turn would lower your risk of getting COVID-19 and getting extremely ill. There are some other things. Metformin, we know, is not only an anti-diabetic drug, but can help with longevity and lower your risk of cancers and inflammatory diseases. One study shows that diabetics who are on metformin have a 70% greater chance of getting out of the hospital with COVID than their counterparts of type 2 diabetes who are not on metformin. So probably has to do with that anti-inflammatory component of metformin. There are other anti-aging or longevity medications that we use in our practice that we'd love to talk to you about that not only help to prolong your life and decrease your risk of diseases, but may also be part of a healthy aging and COVID preventative program. I also want to mention that we do use exosomes here in our practice, which are really the essence of stem cells. There are 2 now FDA trials using exosomes to treat what they call long haulers, so people that have had COVID-19 infection and end up with the pulmonary complications. So we're excited to have that at our hands. We are using these exosomes for other reasons as well, so to decrease inflammation and help with regeneration. So we're excited that we have some things that we've been using for a long time that are now showing up to be either preventative or actually treatment for COVID-19 and some of its consequences. So please give us a call at Better Life Carolinas. Thanks so much, and we'll be back.